Hello everyone and welcome to our free live webinar today on tackling a sometime pregnancy. I am Dr. Parul Chopra, a senior consultant obstetrician and gynecologist here with Apollo Cradle and Miracles Mediclinic, Sector 14, and this is where we are streaming live to you from. So through the webinar, we'll be talking about what are the various problems that pregnant women especially face during this time, the sweltering heat, what all can we do to make it more joyful, more comfortable, and breeze through it rather than just hopefully survive and cope with it. So I'll be very happy taking all your questions. Do keep shooting them in as and when you feel like. Meanwhile, I'll just start with some tips and tricks, some do's and don'ts for this season. We will be going ahead with advice on your clothing, on what to eat, what not to eat, what to drink. We will also be covering when should you be visiting your doctor, especially in an emergency. So summer pregnancy anyways is a time when women feel extra hot. And this is not a very pleasant feeling, hot, hot, hot. This is sticky, this is irritating, it can mess with your physical well-being, with your emotional well-being, and it does take a toll. So one of the very common complaints that we get in the OPD by a pregnant woman, even in the absence of heat, is that she feels unusually hot or feverish when you measure temperature. It would be somewhere around 98.6, 98.8, and very seldom would cross 100 degrees Fahrenheit. We usually reassure women that a temperature of less than 100 is fine. The body radiates extra heat because the body is doing something very miraculous inside. And all of that work radiates heat, which is radiated off from your own body. Especially in summers, overheating can be a problem. And how do you know when this is beyond the normal feeling hot of pregnancy? So in case there is a while that you feel tired, you feel nauseous, you feel dizzy, you feel lightheaded, you're having unusual vomitings, unusual cramps, your body will possibly be getting overheated. Rarely sometimes, it is possible for you to not be in the best of shape and hardly have any symptoms. So the regular checkup with your doctor is absolutely paramount. And we'll start with some advice on clothing. Some of them are very basic and very common sense, but it is worthwhile reminding them to you again. Make sure that you're not wearing anything very tight, anything in very dark shades at this time, like pastels, whites, and baby pinks and sea greens, flowy fabrics, cotton, linen, natural fabrics like malmal. These are the fabrics that you should be wearing. Okay, so we have our questions streaming in, and I will just... So we have a question here, should pregnant women drink more water in summers? Absolutely yes. Summer is a time when we sweat a little extra, we lose water, we lose electrolytes. Especially in a pregnant state, dehydration can be quite an issue. It affects not only you, but also your baby. So your water intake should go up accordingly. The other fluids that you can have, the essential part about the fluids is they should be non-alcoholic, they should be non-caffeinated, hopefully without preservatives, and preferably with electrolytes. So something like a nimu pani, nariyal pani, fruit juices, preferably without preservatives, preferably fresh ones, are a good choice at this time. Plenty of water. You should be passing urine once, at least every 4 hours. If not, your water intake may be less and it needs to go up. Take water or any other fluid sip-wise. Do not try to engulf it all at once. That sometimes leads to a feeling of nausea and can even result in vomiting. Okay, we have another question here. Is it difficult to lose weight you have gained during pregnancy? Well, not directly related with our topic, but not really difficult. And in fact, I wrote an article on this on Tractor.com. It was the ultimate weight loss regime to get rid of pregnancy fat. So, in case you find it worthwhile, you go ahead through the article. Pregnancy weight, we are a little more to worry right now about the summertime pregnancy. Pregnancy weight is meant to be lost. It is not meant to be on you forever. And with a little determination, with a little discipline, and a little more care towards yourself, help and support from the family, it is easy and very rewarding to lose this weight. So no worries on that account, Sheetal. Hi Mayank. certain other. Okay. It's nice to see a few people joining in now. Okay, so we go ahead with our advice on clothing. Light shades, natural fabrics, not very tight clothing, especially on your chest. The brazier size may change more than once during pregnancy, and you need to change the size of your clothing accordingly. Nothing very tight on your abdomen either. The belt should be above or below the bump, and nothing should be constricting the bump at all.
We should be wearing very loose-fitting clothes as bottoms, something like patiala salwars and plazos, because in pregnancy, as your bump grows, also the center of gravity changes. A foot may really get stuck, and you have a higher chance of tripping and falling, something very undesirable in pregnancy. So try and wear loose or pants which are not too flowy, so that the chances of your foot getting stuck is less, and you can walk comfortably without falling. Very comfortable footwear is what we advise. So flip-flops or anything that you're very comfortable with, avoid heels, very important. Okay, so we have a question on swimming during summers. Swimming is one of the very good exercises in pregnancy. It's an absolute joy to swim, and pregnancy time is no different. There are a few precautions I'd like you to take. I don't think all of us can afford a personal pool, so it's all right using public pools as far as we're comfortable about their hygiene, as far as we're confident about the cleanliness and the maintenance of the pool. Try swimming at early morning times when the pool is fresher, when you're in the first or the second batch using the pool. Another precaution that I would like you to take is do take a bath before and after using the pool. That's very important, even outside of pregnancy, but more so during pregnancy. Important thing is, whenever you're walking towards the pool, be very careful about water being splashed around. Pregnancy is a time when you need to walk a little more carefully. We don't want you to be slipping and falling. So just ensure that you always walk slowly, you're always conscious of where you're walking, and you can absolutely enjoy your time in the pool. Even for women who do not know how to swim, it is a very nice relaxation activity to just float around in the pool with the help of floaters, obviously, and be around little kids and other swimmers. Swimming is absolutely recommended and a very good form of exercise. In certain conditions, swimming may not be one of the best exercises for you, and you should be asking your doctor once specifically about your own case before you go ahead with swimming. Okay, we have... Thank you, Bibin. Thank you for sharing the video. And what can I do to feel more comfortable in the heat? Okay, so one advice about the clothing. The second is try not going out too often, especially during peak heat hours. Something like 11 a.m. to 3 p.m. you should absolutely try and be indoors. In case you need to travel to the office, schedule times as early morning and late evening for your travel back. Times which are cooler and the heat is more tolerant outside. Another thing, you always should be carrying a hand towel. It's a very, very good idea. Just soak it in icy water, or maybe have an ice pack, and just rub your face with it, just dab your arms with it. It gives you a feeling of being very refreshed, very cool, and really helps when you're under heat the way it is right now. You can sit in air-cooled or air-conditioned rooms. It's always a good idea to maintain a good temperature. You will notice that pregnant women somehow feel much hotter and would like the temperature of the AC much lesser as compared to the other people. In which case, we would request all your colleagues and family members to please cooperate and allow the temperature setting which is comfortable to the pregnant woman. Okay, so we have another question by Mr. Paresh, and it says, is it safe to air travel this summer vacations? Any precautions to be taken? Okay, so air travel, especially during pregnancy, we recommend as far as possible, it should be avoided. Train travel is by far the safest, but in case one definitely does need to travel by air, or that is the only practical option available, it is not by far contraindicated in pregnancy. However, various factors need to be considered. What stage of pregnancy are you at? How has the pregnancy been so far? What are the other complicating factors in your pregnancy, like diabetes in pregnancy, hypertension in pregnancy, any risk of preterm labor that you may have? And looking at all of those, we can advise air travel as per your specific case. The few precautions that we recommend during air travel: number one, Very important to walk through the flight, and very important to keep moving your legs and toes during the flight. The precautions that are applicable to general travelers for long flights apply to pregnant women even for short flights like 2 hours or 2.5 hours. Make sure you're not traveling alone. Traveling with a companion would be preferable. And try not traveling too much in pregnancy in case you can avoid it. Otherwise, make sure you consult your doctor just before your travel so that she can evaluate and advise you of any particular risks that she can foresee. Okay, so another question is, how can we maintain fitness during pregnancy? Fitness is a very, very important component of pregnancy. The fitter you are, the better your pregnancy goes, the better and more comfortable your delivery is. Excuse me. And the quicker your recovery from childbirth is. All of the common exercises such as walking, jogging, running are allowed in pregnancy depending on how comfortable you have been and how accustomed to the exercises have you been. So somebody who walks 10 kilometers every day prior to pregnancy would possibly be comfortable walking about 6 to 7 kilometers in pregnancy itself. But for somebody who's led a very sedentary lifestyle before, may not suddenly be able to start walking 5 kilometers in pregnancy. You should be comfortable at all points during and after exercise. If you feel uneasy, lightheaded, if you feel overtly tired, if you feel short of breath, if you feel uncomfortable doing any postures or any particular exercise, please withhold it. Relevant to summertime, very important to not exercise outdoors during the heat. Maybe an early morning walk or a late evening walk is something you should be doing. For an afternoon walk, in case you would like to do that, please do it indoors, within your house, within your office. Besides this, it's very important to know. So again, we have lots of questions on fitness during pregnancy. Okay, so the exercises, except for combat sports like taekwondo and judo, the other exercises like swimming, walking are pretty much safe and comfortable for most of the pregnant women. Again, for your particular case, if there is any risk factor, do consult your doctor before embarking on a new routine. Make sure you keep sipping water and electrolytes during your exercise so that you don't get too overheated. Okay, we have a question on itchy eyes. So, hi Jyoti. She says, how do I get rid of itchy eyes due to the summer? Now, itchy eyes can be because of a lot of reasons, one of them being the dry heat of the summer. Excuse me. The best person to take care of the eyes at this time is your ophthalmologist, the eye specialist, and you must visit the eye doctor in case you feel there is any unusual redness. Sometimes, certain more uneasy complications can be a cause of the itchy eyes. The usual precautions that you should be taking about itchy eyes in pregnancy, especially during the summer, are make sure you blink a lot and avoid screen time, something that has been a bane for all of us. Screen time includes laptops, phone screens, televisions. All of these devices, if you can limit the exposure that your eyes take, is much better. Make sure you take frequent breaks when you're working on a laptop or seeing something on your phone. You must take a break and switch off your screen every 20 minutes at least. Blink very often. If you take plenty of fluids and are well hydrated, that helps in relieving the itching a bit. The eye doctor usually will do an eye examination, rule out any complications, and advise some lubricant eye drops. Lubricant eye drops mostly are very safe in pregnancy and are highly recommended if your itchy eyes persist during pregnancy. Okay, we have another question here by Laurent. Hi, is summer direct sunlight harmful for my baby? Now, summer direct sunlight does not directly reach the baby, so it is not directly harmful to the baby as such. However, it does cause problems to the mother's body, and through that can be a little detrimental to the well-being of the baby. Make sure when you do go outside, you apply dollops of sunscreen. Wear a wide-brimmed hat. Sunscreens, by the way, are safe in pregnancy and are needed to avoid sunburns. Make sure you wear comfortable clothing, carry an umbrella, carry a cool towel to just dab your limbs and your face with it. Make sure you're wearing sunglasses. Make sure you're not in the direct heat for a very long time. If you do have a feeling of lightheadedness, nausea, vomiting, uneasiness, you must quickly try and move to an air-cooled room. Okay. So another question by Sheetal. Hi. So she says, my hands and feet have got swollen. All my reports and blood pressure are normal though. So hands and feet swelling in pregnancy is a very common issue. In some cases, it can be due to an underlying pregnancy-induced hypertension, and which has implications for the whole of your body and well-being. Your liver, your brain, your pregnancy, the duration of your pregnancy, the growth of your baby, your skin, your blood clotting, everything can get affected. And it is absolutely pertinent to meet your doctor to rule out this slightly severe complication of pregnancy. In case everything else has been ruled out, your blood reports and your blood pressures are normal, your urine reports, including the urine proteins, are normal, we can largely rest assured regarding the swelling. But we still need to tackle it. And some of these maneuvers really help. Every time you go to sleep at night or take a wrap during the day, make sure that you're on your side and not lying flat on your tummy. Lying on your back after the 4th month of pregnancy can result in worsening of this swelling. Also, put in some cushions, maybe a big cylindrical cushion or 2 or 3 pillows under your feet. So when you're lying on your left side, the right leg is up and the swelling drains out. You'll notice the swelling reducing after about 2 to 3 hours of rest during the day or in the night. After you get up in the morning and then walk through the day, the swelling will worsen again. However, if you're reducing it twice a day, it'll be much more manageable, it'll pain less, and there will be a less possibility of it progressing to varicose veins and leading to other troubles. You can take massages for tired legs, for swollen legs. They essentially need to be from a distal end to the direction of the heart, which means when you're massaging your hand, I hope you can see my hand, yeah. So it should be in the direction from the finger to the wrist and from the wrist down to the elbow and to the elbow up. Similarly, when you're massaging your feet, they should be from the foot to the ankle, from the toes to the ankle to the knee, and the direction of massage should be from the knee to the hip. That will help in relieving the pain that you have. That will also help in relieving the edema. But there is a word of caution. If your legs feel unusually tired, if there is severe pain or swelling, especially in one leg, if you see any blue signs on the leg, please consult your doctor urgently. Rarely, the swelling can be because of some difficult condition such as deep vein thrombosis, which can be quite threatening to both you and your baby and needs to be ruled out at the earliest. If your doctor reassures you that the pregnancy is fine and the deep veins are perfectly all right, nothing to worry. With this leg elevation and hand elevation, so when you're sitting, don't hang down your hands. Maybe you can keep your hands up for a while. Rest them on some surface for a while so that the swelling drains out with gravity by and by. Okay, so hi Harsh. She says, I'm craving ice cream, aren't we all? And worried about infection. Is it safe to eat? Okay. Now, ice cream by itself is a processed food and is quite safe to eat in pregnancy. So anything that is made of cooked milk and cooked eggs and cooked gelatin is fine in pregnancy. In moderation is the key before we get too happy about the prospect of ice creams. They should not replace your balanced and healthy diet, but otherwise ice creams are perfectly fine with most of the women. Of course, if you're allergic to milk or allergic to egg, please avoid ice creams, and I hope you aren't craving for them then. But otherwise, ice creams are largely safe to eat in pregnancy. Hi, Sumegha. So Sumegha has a question on skin pigmentation. So skin has become pigmented in pregnancy. Will it go with time, and what can be done about it? Skin pigmentation is quite an issue in pregnancy per se, even with wintertime pregnancies. There are quite a lot of myths that go along with it. But we have a very reassuring advice for this. Most of the skin pigmentation goes away after the pregnancy. These are because of the elevated hormones of pregnancy, and you don't need to do anything particular about it. If it's itchy or red lesions appear, you may need to see a skin specialist who will advise some very safe creams and lotions. Otherwise, the daily routine of cleansing your skin with a mild soap-free cleanser, followed by moisturizing your skin, would suffice. Nothing else needs to be done about it right now, And after you deliver a beautiful baby, you're going to get back your beautiful complexion again. So no worries at all, Sumeka. Okay, there's a repeat question. I think should we drink more water during the summer, especially for pregnant women? Okay. So water, again, like I had just mentioned before, we do need to increase our fluid intake, and not just that of plain water, but all other fluids which are non-caffeinated, non-carbonated, and non-alcoholic certainly. So pani, nimbu pani, nariyal pani are excellent fluids at this time. And you must hydrate yourself well. If you're passing clear water like urine every 4 to 6 hours, it's a good indication that you're well hydrated. Okay, we have another question from Shweta. Hi Shweta. Says most fruits during the summers like mango, plum, peach are known in Ayurveda to be hot in tasir. So could they be harmful if eaten by pregnant women? Also about nuts like almonds and walnuts. Okay. Now I love all seasons, and I very honestly believe they all bring with them gifts that we need to unwrap and enjoy during that time. Summers bring with them the king of fruits, mangoes and plums and peaches, all lovely fruits with watermelons and cucumbers. They are totally safe to be taken by a pregnant woman. Moderation once again is the key. Please do not replace your lunch with 4 mangoes, but 1 mango a day taken by a pregnant woman is absolutely fine and comfortable. In fact, with latest research we know mangoes are even safe for diabetics if eaten in the right manner. You need to take a non-processed mango, so try avoiding making a mango shake with it, but you can have a mango, and a small mango or maybe half of a big safeda should be all right. Sit with it, relish it, eat it with all your senses, and you should be fine. It is a source of excellent nutrients for you and very hydrating, especially fruits like cucumbers and watermelons are very hydrating for you, and you must enjoy them without guilt in this summer. Now about nuts like almonds and walnuts. A pregnancy and the postpartum time when you've just delivered a baby usually encompasses the whole year, and we in India, in Delhi and Gurgaon, are quite fortunate to have all seasons here. So there will be a time to eat nuts, and there will be a time to eat the mangoes and the watermelons. If we eat seasonal fruits, our digestive systems are far more likely to digest them comfortably, and it makes much more sense for us and for our baby. Sometimes we get a little too impatient feeling that nuts are good for my baby, so let me have all of them in the summers. Difficult to digest and not a very good idea at this time. The appetite is a little lower, we are all craving more fluids, more juicy fruits, and that is what you should be having. If you deliver your baby in the summers, when you're breastfeeding your baby, when the winter season comes, please gorge on all the nuts and the gajar ka halwa and everything at that time. So eating seasonal, culturally appropriate, and food that you like is very, very important in pregnancy. The baby's development, especially the brain development, happens over 1,000 days. So we have 270 days of pregnancy plus 365 days of the first year and the second year to influence the baby's nutritional intake. Also, if we can't digest what we are taking, it wouldn't be a very good idea to load your system with it and then feel very uneasy about it. So please go ahead, have your plums and peaches and mangoes in moderation, and they're absolutely safe in pregnancy. Okay, hi Neha, we have a question by Neha. Is it fine to sleep on my back during pregnancy? I'm in my 5th month. Largely after 16 weeks, which is the end of 4th month of pregnancy, we advise you to avoid sleeping on your back entirely. Because the uterus has now, the womb has now grown to a size wherein it can reduce the blood flow returning to your heart. It would be wise if you can lie on your side. The left side is better, but the left or the right karvat is good enough. If you have a lot of difficulty lying on your side, you can maybe lie flat and put a pillow under one of your buttocks. So the pelvis area, the area where the pregnancy really is, gets a little tilted. A 30 degrees tilt is good enough for us to relieve the pressure from the veins and will keep you quite comfortable and the pregnancy is safe. It improves the blood flow to the pregnancy, so that is a good motivation. Some of us get very worried about this and they're like, during my sleep, maybe for about 5 minutes, I was lying absolutely flat on my back. Will my baby be harmed? No, it won't. But whenever you realize, if you can just correct your position, it would be a good idea. Okay, so we have a question by Swati. What should we eat in the last 2 months for making yourself prepared for a normal delivery? A normal delivery is quite a glory and desirable by so many of us, obstetricians and patients alike. Now, a lot goes into a normal delivery than just what you eat. So the amount of exercise you've had, the position of the baby, the risk factors in the pregnancy, the pelvis, a lot of factors that ensure a normal delivery. Especially regarding eating, you mustn't overeat or undereat during pregnancy so as to ensure the correct weight gain. Now, the correct weight gain during pregnancy also varies with each person. If you have been underweight prior to pregnancy, we would want you to gain a little more weight during pregnancy, something to the tune of 15 to 20 kilos in somebody who was underweight by 5 kilos prior to pregnancy. If you were of an average build, a weight gain of 10 to 15 kilos is an average good weight gain in pregnancy. If you have been overweight or obese, maybe even a weight gain of as less as 6 kilos is normal for a pregnancy. So depending on how your build is, you must always eat the right foods in the right quantities. If you're delivering in summers, obviously your deliveries will be preceded by all mangoes and plums and peaches and more juicy fruits, more the summer vegetables of tinda, karela, tori. And if you're delivering in the winters, your delivery is going to be preceded by ghee ke laddus and gajar ka halwa. So seasonally, it does make a difference. For summertime, if you're due for delivery anytime now or the next month, relax, eat seasonally appropriate food. There is no magic food that you can have that will increase your chances of a normal delivery. Can I continue to go to work up to the last week of pregnancy? I work at a desk job in the IT sector. Hi, Kanika. Okay. Now, working during pregnancy, it again varies a lot with the person, the kind of work, and how has your pregnancy been. I'm very fond of that movie, What to Expect When You're Expecting. So it gives you a good spectrum, roughly, of how different pregnancies can be. If you're comfortable physically, mentally, emotionally, and would like to work, if your work is such that the workplace isn't too far from your home, you're comfortable traveling to and from work, the environment is stress-free, and if your work fulfills you and makes you happy, by all means, please go ahead and work, unless there are any specific complications like preterm labor, which your doctor will warn you about. You may actually go to work till the last day, but like you mentioned, it's a desk job in the IT sector. One of the drawbacks is the postural problems and the lack of moving through the day. Make sure you get up every 30 minutes, take a little walk around the office. Make sure you eat every 2 hours and can take frequent breaks during work. And if you're comfortable, go right ahead till your last day. If not, please do not feel competitive about how long you work in pregnancy. Please feel very free to take a break whenever you feel like. It may be a physical condition like your backache worsening or your feet swelling worsening. It may be an emotional condition wherein you now just want to focus on the baby who's arriving and want to really enjoy your last few days of pregnancy. Please go ahead, feel free to do that. Do not feel compelled to work till the last day of pregnancy if you inside do not feel like it. It's equally wise and equally wonderful to take a break, put your feet up, relax and connect with your baby during this time. It's a very special time and you decide how best to make use of it. Okay, we have a question here. My wife is 2 months pregnant and she feels more sun sensitive now. Yes, sun sensitive is something that the sensitivity increases in pregnancy. Dollops of sunscreen, a wide hat, sunglasses, avoid going out in the outdoors like I just mentioned. It is important to protect yourself from direct sun, from a blazing sun at this time. Okay, so Sumegha has a question again. Traditionally in Indian families, we are advised to have ghee, but is it advisable in summers? A small amount of ghee, for example, maybe a spoonful through the day, wherein you put it on your chapati or use it for cooking a vegetable, is absolutely wonderful for you. It is needed for the essential fatty acids and vitamins that it can help absorb, and you must have it. However, overloading yourself on ghee is not a very good idea, especially in the summer months. When you have winter deliveries, maybe the panjiri and the laddus, which have been made so lovingly for you, can be started in the 8th or the 9th month, provided your weight has been in the normal range and they aren't too sweet and you're craving for them and you're happy to digest them. Otherwise, in the summer months, where the deliveries that happen in summer aren't very comfortable being preceded by ghee preparations prior to delivery. I would suggest we hold off this lovely panjiri and laddu and the whole goodies that come along with delivery And we take them when our baby is 3 or 4 months old, around November, October time, when your body is much more comfortable digesting that amount of ghee and sweets. Okay, and before I realized our time is nearly up. That is quite wonderful. So I just take one more question. Is it fine to eat an egg daily during summer? Yes, absolutely. Eggs are wonderful even during the summers. Egg whites especially are high in protein. Please go ahead and have your egg guilt-free even during the summers. Thank you so much from all of us here at Apollo Cradle and Miracles Mediclinic. For some of the questions that I've not been able to take, please feel free to drop in to us and we'll be very happy taking care of you here on. I wish you all a very happy pregnancy and a very safe and joyful delivery. Bye-bye.